Millions in federal dollars have also poured into Valley Health clinics. They are funded, but as Valerie Gonzalez reports, some just don't have the clients. Valerie.
3 weeks ago, the federal government handed out nearly $5 million to clinics all across the valley. But with fewer patients showing up, their budgets are starting to bleed. Thousands of people rely on the services offered at federally qualified health centers. When the pandemic started, clients were advised to stay home, but so far, they haven't come back. Bronzeville's Community Health Center saw a notable drop in visits.
I can tell you that it's half of what we were seeing on a daily basis.
Nuestra Clínica del Valle saw a greater impact.
If we see 6,000 visits a month, right now we're down to, if we're good, about 1,600.
Lucy Ramirez Torres with Nuestra Clínica says they are using their nearly $1.5 million of federal money for two things.
Part of the money that we received is going to be used for testing. The other part of the money is going to be used to maintain our capacity as far as staffing.
Bronzeville's Community Health Clinic, who got $1.1 million, is doing the same. Both are offering COVID-19 testing to current clients. They're also trying to survive as a business.
Approximately, I would say about 55% of our revenue is also from the patient fees that we collect.
The clinics are using funding to stay afloat and to make sure they're around to offer services for the public whenever they come back.
We were hoping that we would reduce the number of people that would leave their jobs because of the fear of getting COVID-19. It seems to have worked. So we've had 2, maybe 3 people that have resigned.
Nuestra Clínica also saw about 3 to 4 resignations. They had to close 3 sites temporarily. People are afraid to go into medical facilities right now, but it's not just the virus they fear.
And I know that there was fear there's always fear, but people are being stopped in the streets, and it's somebody in a uniform, and so that fear is there. That I have heard.
The clinics serve the uninsured and don't ask questions about immigration status. This population is also affected by transportation. Not a lot of people riding buses during this time. Still, the public is urged not to neglect their health.
Because if you wait, then they're going to get sicker, or they may not, or they're going to have a harder time with their illnesses or conditions.
Clinics are doing all they can to disinfect, separate, and assure their clients it's safe to go back. We also spoke to the executive director for the Community Action Corporation of South Texas. They also received some funding. They held the portions above the valley like Brooks County and AWOLD. The executive director told us the same thing that we've been hearing from clinics here. They're all grateful for the money. The real problem is having access to more testing materials. So once the supply lines open up and freeing up more of those resources, they'll be able to offer more testing here locally. In San Juan, Valerie Gonzalez, Channel 5 News at 6.